All right, we are back. Welcome to this episode of Weekly Dose with Dr. Uday. So I have Dr. Hagan back for a part two. Part one was amazing, so I figured we would do part two. So the last episode we talked about Crohn's disease. This episode we're going to be talking about ulcerative colitis, which is also a type of inflammatory bowel disease. So same thing for introductions. My name is Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care and aesthetic practice, and my goal is to have my patients feeling and looking good. So for a little bit about Dr. Hagan before we get into what we have for you today. So just like I said for the last episode, she's board certified in gastroenterology and hepatology with a subspecialty in inflammatory bowel disease, which is why we're having her talk about these two disease processes. She is the medical co-director for the Center for Inflammatory Bowel and Colorectal Diseases at Mercy Medical Center. And she's also the site director for Mercy Clinical Scholar Gastroenterology and Hepatology Fellowship Program. So Dr. Hagan, thanks for coming back. We appreciate it.
Thanks for having me.
So we're going to be switching gears. It's going to be ulcerative colitis. So we're going to get right into it like we did the last time. So what is ulcerative colitis?
Yeah, so if the audience had a chance to see the previous broadcast, as I defined it, ulcerative colitis is one of the inflammatory bowel diseases, wherein a person who has particular genetic susceptibility or just how they're created, they get exposed to some environmental factor, and the immune system responds in a way that causes the intestinal lining to be injured. The key distinction: Crohn's disease pretty much affects anywhere from the mouth to the anus. Ulcerative colitis, in contrast, only affects the large intestine. And in terms of how it presents, ulcerative colitis tends to present typically with, bloody diarrhea, or patients will just say that, I just, went to the bathroom and nothing came out but blood.
Wow. Okay. So that's definitely a difference from the Crohn's disease. So it looks like you went into my next one, which was definitely the symptoms. So perfect. So what are the complications for ulcerative colitis?
Yeah, so with the symptoms come, I mentioned sort of bloody diarrhea being sort of the salient symptom. People can have cramping, they can have weight loss depending on how much of their gut is involved. They can have anemia, and they can also have those extraintestinal manifestations that I alluded to before, with joint pains and skin manifestations or eye manifestations. And then in terms of the complications, the major complication is need for surgery. So for ulcerative colitis, some people can present, and it really depends on how much of the large intestine is also affected. So if only the rectum is affected, most people will have, the tendency to feel like they have to go all the time, but they may not have any significant, what we call systemic symptoms, or symptoms that, have to do with the sort of the rest of the body per se. And if, more of the large intestine is affected, like the left side or even the whole intestine, then their symptoms could, appear more significant, or the patients can appear more sick. You can have what we call fulminant colitis, which is basically the person from the time that they present, it could be right away from the initial diagnosis or even after they've had their disease for a while, where the large intestine is so sick that the whole body can get very sick. And then the only way to make the person better or save their life is to have the large intestine surgically removed, which is what we call a colectomy. And that's a small proportion of patients will present with that kind of severity. So when we talk about complications, the need for surgery, whether emergent or planned, is one of the potential complications. And then short of that, it would be, the other things that can happen, the disability from loss of productivity or missing work because of your symptoms, not being able to get in touch with, get in touch with friends and colleagues and things like that. So the quality of life is affected. One of the major complications, of course, is colorectal cancer, and that's true for Crohn's disease. If at least more than a third of the large intestine is involved, and often for ulcerative colitis, that tends to be the case. So chronic inflammation in the large intestine puts people at risk for colorectal cancer. So that's one of the major complications that we try to avoid, in addition to sort of just needing surgery to begin with. And so part of the care for Crohn's and colitis patients and ulcerative colitis is, first, we want to get you better. We want to get symptoms under control. We want to improve your quality of life, but we also want to minimize complications. And one of the ways that we minimize the complications, specifically with respect to colorectal cancer, is getting inflammation under control and also doing what we call periodic surveillance, where you would get colonoscopies even after the disease is under control, to look for any changes in the lining of the intestine that could put you at risk for colon cancer down the road.
Gotcha. So you actually, that's amazing. So you answered the last question I had, so you're right on it. Now, for people that, is there a hereditary component, like same question?
Yeah. So again, you have to have genetic susceptibility, but just because a parent has it does not mean that their children will definitively have it. And for some people, they'll say there's nobody else in my family that has this, because again, having the genetics alone is not enough. You have to have that environmental exposure, and then the immune system also then has to have that aberrant response in order for the disease to manifest itself.
Gotcha. So same question as before. How do people get a hold of you if they want to connect with you or learn more?
So again, I'm a Mercy doctor in Baltimore, Maryland. So going through the Mercy website would be sort of the way that one can sort of gain access as far as being able to get in touch if needed. So.
Oh, thank you, Dr. Hagan. Appreciate it. So guys, you've heard. So if you need more information, I will definitely include her information with this episode. If you're looking for a primary care doctor, give us a call at Apple Valley Family Medicine. Our number is 304-350-1087, and our website is www.applevalleyfamilymed.com. Please like and share. This, I'm pretty sure, will benefit someone out there. And then you will certainly reach out to Dr. Hagan if you need to. Dr. Hagan, thank you. All
Thank
right,
you.
bye.
Bye.